Of course, there's been particular concern about the impact of COVID-19 on the elderly. The Centers for Disease Control and Prevention says the greatest risk is not the virus itself, but existing and underlying health conditions that may compromise a person's ability to fight then that infection. Let's discuss how the elderly are likely to be affected. We're joined by CEO of Auria Senior Living, Barry Kaganson. Good evening, and thank you so much for your time tonight, Barry.
Thanks for having me.
I mean, you've seen perhaps some of the figures that we're watching in Italy, and you know that death rate that continues to soar through the roof. How concerned does it make you about the elderly population that's living in South Africa?
Kathy, it's extremely concerning. Statistics I read just yesterday coming out of China in terms of mortality rates. Mortality rates for people between the ages of 80 and 90 was reported at 15%. Mortality rates for people between the ages of 70 and 80 was reported at 8%. If one looks at global statistics, and indeed the same is true in our experience of people living in our communities, the average age of people moving in is 78, and the average age of people living there is 82. We run continuing care retirement communities, which means we have a mix of independent living, assisted living, and dementia care. If one looks at the average age of the residents in our care centres within our communities, the average age is probably a lot higher than 82. Don't know what it is, but it's certainly late 80s. So we're definitely very concerned, and we're taking all the appropriate measures and doing our very best to make sure that we protect our residents to the best of our ability, as well as our staff.
Let's talk then about some of those measures that you've been implementing and when exactly you started putting them in place.
Yeah, so we started already a week before last. It's a very good question you ask, when did we start putting them in place? I actually received a World Health Organization guideline for procedures and practices within care centres, and it was actually only published on the 21st of March, which was Saturday. And we started putting these measures in place already a week before last. We took a decision that we're going to panic early, and that's what we did. Just to put a few of those measures into perspective, we already started testing people's temperatures when they entered our communities. We put very strict access controls in place for visitors. Now, at this point, we actually completely locked down all our facilities, and we've prevented visitors from coming in at all. We've also done temperature testing on all our staff, but I think the key measure that we've put in, we've tried to put this sort of, we call it a virtual bubble, protective bubble in place around our communities. But of course, as is quite topical at the moment, one of the weak points in that bubble is our staff, who are commuting every day, as you're aware, on taxis and public transport and buses, etc., etc. So what we've done is we've actually instituted a 14-day shift cycle, and during that cycle, we're getting our staff to actually reside on site across our communities. So we've made accommodation available for them, we've made meals available for them, and the idea is to limit their exposure to public transport, and in doing so, their exposure to other people, which of course raises their risk of infection.
Sure. What are your clients saying to you about the rapid spread of COVID-19 in the country, and how worried are they for their own health?
So I would say that they are extremely concerned, and rightfully so. However, they are very thankful that they're living in professionally managed communities such as ours, that we are able to put these protective measures in place, and that they are able to obtain services that can assist them in times like this. Specifically, I'll take the example of a lady who recently we put into quarantine after she came into contact with a family member who was tested positive for COVID-19, and she was checked on every day. She was offered to be provided with meals and various other conveniences. So whilst they are concerned about the COVID-19 virus, they are assured that we are taking all measures possible to protect them, and they feel very fortunate they are able to live in a professionally managed community, such as a community like ours.
It's such an important point that you raise, because not all the elderly in our country have access to these kinds of facilities. So from a community perspective, what is it that we, as ordinary South Africans who know that we have perhaps elderly people who are our neighbors or who live down the street from us, how differently should we be responding to them and also aiding their ability to be able to survive this time?
I think you've answered the question perfectly. I think we need to be doing exactly that. We need to be cognizant of the older people within our communities, cognizant of what they need, looking as to where we can assist. And of course, the guidelines have been published. They are out there. Everyone knows social distancing, hand sanitization, ongoing hygiene, and also just looking out for those people and understanding if they need assistance in their homes, in situ, where they are, and encouraging them not to go out and to minimize contact with other people, and in so doing protect themselves and minimize their possibility of being infected with the virus.
I wonder, how much compliance have you been getting from the families of your clients in particular?
It's a good question. Compliance has been pretty high. Every time we put more stricter and more stringent measures in place, the families have generally thanked us rather than complain. We weren't quite sure which way it was going to go, but it's definitely gone that way. So I think everyone's fully aware of the risks that are being faced by the elderly.
And in as far then as the announcements that are expected to be made by the President tonight, should we go into a further state of lockdown, how will that affect you?
I'm not sure what that state of lockdown will entail.
Sure.
I would imagine that it would have some concessions for essential services. We are certainly an essential service, as is our nursing staff and our care staff. So we believe that the operating environment might get a little bit more challenging, but of course we'll have to deal with it as it comes.
Sure. How long are you going to be locking down your facilities for? You've told us that you've already implemented a lockdown anyway. How long is it going to last?
As long as it's absolutely necessary.
All right, and at this stage, we don't know exactly what the time frame might be. We're really in a state of flux, not just as a nation, but I think as the collective global community. Now, and of course, that was Barry Kaganson. He's the Chief Executive Officer of Auria Senior Living.